Thanks for joining our special live coverage of the policy discussion with citizens. We are waiting for the 8th such meeting to begin. This is where members of the public and experts take part in briefings where ministries present their annual policy plans. Now, President Yoon Suk-yeol has entered the room to deliver a speech. We'll come back right afterwards.
바로 at ease. 모두 자리에 앉아 주시기 바랍니다.
Please be seated.
지금부터
We will now
생명과 지역을
begin
살리는 의료
our
개혁을 주제로
policy
8번째
discussion
민생토론회를
with
시작하겠습니다.
citizens on the theme
먼저
of medical
대통령님께서 모두
reform.
말씀을 하시겠습니다.
The President will deliver his opening
안녕하십니까.
remarks. Good morning,
어제
everyone.
경북 문경에서
Yesterday, I was at
발생한 큰
문경,
화재로
문경
구조 작업 중에
경북.
소방관 두 분이
There was a big
안타까운
fire
일이
accident, and we
발생했습니다.
lost two
이 토론회를 시작하기에
lives
앞서
of firefighters.
김수광
So before
소방교,
we begin our
박수훈
discussion, I would like
소방사
to
두 분의 명복을 빌고 유가족과 동료
I would like
소방관들에게
to
위로의
console
말씀을
the
드립니다.
bereaved families and also the victims
지원도
of
필요한
the
일들을
firefighters Kim
세심하게
Soo-kwang.
챙기겠습니다.
I would like
오늘은
to take more deeper
민생토론회로
look
의료개혁
into such
문제를
accidents
논의하는
so that it does not occur
우리가
again.
살면서 여러
At this
어려움을
discussion,
겪지만
we are going to
내가
talk about
아프고
our medical
내
reform.
아이가 아픈 것만큼
And as we live,
어려운 일은 없을 것입니다.
one of the most difficult predicaments is that when we are sick or our children are ill,
이런 말이 유행하는 나라는 좋은 나라라고 할 수가
I would
없습니다.
not say that it is a good country where
지방에
there are
산다는 이유만으로
the
제대로 된
terms
의료
of
서비스를
wandering
받지
from
못한다는
emergency rooms to another or
선진국이라고 말하기에
pediatric
부끄러울 것입니다.
open run. We could not say
우리나라는
that such
세계
country is an
최고
advanced
수준의
country.
의료진 역량과
Our country,
건강보험
Korea, we
시스템을
boast
갖추고
the
있습니다.
the world's
불구하고
best medical staff
의료
and
시스템
health
붕괴를
insurance
걱정해야 하는
system.
이
And
현실이
nevertheless, we have to
매우
worry about the
안타깝습니다.
collapse of our healthcare
그래서
system.
저는
And
지역
therefore,
완결적 필수 의료를
the essential
국정
medical
과제로
service
임기 초부터
was
지시한
one
바 있습니다.
of my administrative
작년
tasks
10월에는
ever since
무너져가는
taking
의료를
the office.
다시 살릴 담대한
Last
의료 계획을
year in
약속드리고
October, we
실천
promised
방안도
the
꼼꼼히
people the
준비해
audacious
왔습니다.
medical reform, and we
오늘
have been
발표하는
meticulously
4대 정책
prepared
패키지는
the
무너져가는
solutions.
우리
And today,
의료
we are
체계를
going
바로
to
세워서
announce the four major
국민의
policy
건강과
packages
생명을
so that
지키겠다는
we can
약속의
make sure
일환인
that the
바와
system,
아울러
medical system, is
우리
in place
대한민국의 의료
to
산업을
uphold and protect the
세계
people's
최고의
livelihoods as
수준으로
well as their safety
발전시키겠다는
and their health,
그런 저희들의
and also to
계획이
enhance
담겨
and
있습니다.
to grow this, advance this
먼저
into a
충분한 의료
world-class
인력
one.
확보가 중요합니다.
First of all, we have to secure sufficient medical manpower because we are facing a growing elderly population era, and the health industry demands are also growing, and therefore we have to provide high-quality medical education and training environment to support this. Even if we have the best system, if we do not have the manpower to exercise this, this is something of a no use. So we are going to have a medical system that is so that we can nurture the best quality manpower, and also we are going to
고의나 중과실로 판명되는 경우는
have a comprehensive medical accident-related system so that the doctors can provide medical care to the best of their beliefs. At the moment, they would have to go under investigation of the police, and the victims do not receive their adequate compensation. So with this comprehensive improvement, we are going to make the system so that the medical staff can provide their care and the victims have a generous compensation. And also, I would like to promise that we are going to establish a fair compensation system for essential medical staff. The essential medical staff are going through laborious working hours, and they have to be on a standby almost 24 hours a day, and they have to have a fair compensation system. And to do this, we are going to invest more than 10 trillion Korean won. And also, health insurance system that will be reformed so that this does not hinder the soundness of the health insurance finance. We also would like to revitalize the local medical care and to open an era of local policies in local regional areas. And to do this, we are going to establish a fundamentally local medical care that is revitalized, and also expansion of local talent selection policy, create a local policy medical fee, and establishment of local medical networks. We believe that we are at an important crossroad, so to say, a golden time to revitalize and revamp this system. And this is an essential task for the government to carry out. We are going to look at the people and the people's livelihoods and their future only. The tasks that needs to be carried out swiftly, we are going to expedite it as much as possible. And for other issues that need more special care, we are going to establish a committee that is under the president directly, so that I can look at the issues that are being carried out and developed. Today, we're joined by many citizens and also the practitioners, directors of local hospitals and families of medical accidents, and scientists, and so on. So I would like to hear your precious opinions so that we can reflect this to our policy making. Thank you very much.
말씀 감사합니다. 이어서 영상.
That was our live coverage of South Korea's 8th policy discussion with citizens, with President delivering the speech. If you missed it, you can still catch the highlights on our upcoming newscast at 12 p.m. Korea time. Thanks for watching.